everybody. I hope you're having a great Thursday morning. Welcome to the Arizona Commerce Authority Small Business Boot Camp and Resource Collective. I am Robert Theobald, the Small Business Ombudsman and the Vice President for Small Business Services here at the ACA. We got another great safety session today in the boot camp. First, I want to thank all of our community partners that are help supporting the boot camp series that we're doing. We could not do this without them and their expertise and their support, so we appreciate all of them. Just a reminder, the Boot Camp and Resource Collective is designed to help prepare small businesses of less than 20 employees. However, it is open to all business sizes to emerge from the COVID crisis stronger than ever. It is a statewide initiative supported by the community partners we list on the previous page and many others that are helping out. And it is a daily boot camp that will continue through the end of June, and a resource collective. On our website, we have a separate page with the resources that can help support your business. This week's sessions, we've had a great PPP forgiveness session. We will have another one in the future, tentatively planned for June 15th. New guidance came down, so we'll talk about that shortly, but we will have another one. Keep an eye on the schedule. We may bump that up as well. We had some virtual sales training yesterday from Sandler. It was a great session, and that you can watch that recording on our website. Today is safety in the workplace again, and tomorrow will be marketing to return stronger. So some updates on the PPP. First, there's still, as of yesterday evening, there's still well over 100 billion remaining. And the great part about that is the Senate, last night, passed the House bill. And so it's awaiting the president's signature. And there's going to be a lot of positive changes with that. We are going to cover that in a future PPP session. Those changes help make it easier for businesses with PPP loans on the forgiveness and the timeframes involved. So look forward for more information on that. The past couple of days, we've covered some of the great results that we've seen from round one and round two of the PPP and the EIDL loans impacting Arizona small businesses. Again, when you combine PPP and EIDL, Arizona small businesses have received over $9.5 billion in funds to help get them through the pandemic. So just a reminder, please leverage the resources that are available to small businesses throughout the state. We work closely with the small business development centers, and we can help guide you to which center is best for you, help you navigate some of the SBA programs. Our workforce team can work closely with employers to help develop programs, help find employees, and be a resource for you as well. And then if you're a manufacturer, our Arizona MEP team is one of the top in the nation and is an excellent resource to help your manufacturing facility. Just a reminder for all things for the state for COVID-19 information and resources, check out Arizona Together. We also have this resource guide available, and these are resource guides to help your business return to work, following the different guidelines that work from restaurants, hair salons, retail, various different guides to help support you as you get your business going again. Also, for small business resources and other COVID-19 related business items, please check out our website at azcommerce.com/COVID-19. On the webinar section, you can find the boot camp and all the previous boot camp sessions that are recorded, and you can watch those and also pull the information from the slides that were there. Today's speaker, we have Ed Tobby and Amber Pappas again. Ed's gonna be the main speaker today. Amber could not make it today, but she was definitely instrumental in helping with the preparation of today's topic. So we've heard Ed before. He's updated the information, and we have some new information to help you return to work stronger with the COVID-19 pandemic and keeping your employees and customers safe. So we're gonna turn the time over to Ed. If you have questions, feel free to leave them in the Q&A box or in the chat box. So Ed, it's all yours.
Very good. Thank you, Robert. I appreciate the opportunity to join you again today. We've done a number of these and they've been very well received so far. So we want to keep moving, and each week we've tried to update the content a little bit, or maybe change our perspective slightly. So this week we're focusing not only returning safely to work, working safely, but also we want to try to also start talking about building confidence. Not only building confidence in our workers, but also building confidence in our customers and trying to make sure that they feel comfortable and safe in our businesses. So as I mentioned, as you mentioned, actually, I'm Ed Tobby. I'm a safety trainer here for the Arizona Chapter National Safety Council. I specialize in safety training of first aid CPR, defensive driving, lift truck, construction zone flagger, bloodborne pathogens, and then some of our advanced safety certificates courses of principles of occupational safety and health, safety training methods, safety management techniques, incident investigation, ergonomics, team safety, and job safety analysis. Normally Amber would be on our presentation today, but she is actually out doing what she does best, which is assisting her clients keep their workplaces safe, and specifically helping them manage some of the OSHA regulations and building safety plans and procedures that are going to help their workers. Our goals today are going to help business owners develop processes and procedures. They're going to help ensure that everybody is safe, both their employees and their customers that come to their building. And by doing that, it's going to help build confidence in both of those groups that they can come into the building. They know that your priority is safety and health, and they can feel comfortable that they can, now that some of the restrictions have been eased, start to return to pre-COVID type conditions. Now we know that there's some things that are in place that are going to remain there for quite a while, such as distancing, maybe face coverings, some of those things. We acknowledge that. But beyond that, we want to try to make sure that people feel comfortable engaging once again with other people and with businesses. And along the way, by doing this, we're going to communicate a positive safety message to everybody that we are in contact with. So as I mentioned, I'm an employee of the Arizona chapter of the National Safety Council. You'll see at the top, NSC just June 1st implemented their new visual, their new logo. I like it, it's nice and clean. And so we're working on that. June is also National Safety Month. So we have a lot of information that's available through the NSC website in regards to National Safety Month. Locally, we've scheduled some additional first aid CPR courses here that we're doing, and we're able to fill those with some people that are looking to be able to respond in an emergency. One of the things that NSC did right after the pandemic was declared, they had a call to action. And we are a membership-driven organization. We have over 50,000 members on a national level. And these are companies across the spectrum, anything from small businesses to Fortune 500 companies. And we recognized the need very early on to start to find ways to give guidance to businesses on how to safely return to the workplace once it's declared safe to do so. So this SAFER acronym, Safe Actions for Employee Returns, was created by this task force that that was gathered. The link for that, nsc.org/safer. I would encourage you to visit that site. There's a ton of resources in much more detail than we can possibly cover today. But this SAFER document or program that they put together is kind of the basis of most of what I'm doing today. I've added some other things as well, but that's kind of was my primary source for today. And so this task force, as I mentioned, is made up of small businesses, large Fortune 500 companies, nonprofits, legal experts, public health professionals, and government agency representatives. It was really important for us to get a cross-section of perspectives and ideas and experiences and expertise when we start to create these sorts of programs. Because people do look to the National Safety Council for guidance. They look to us as to be the kind of a leader in the industry on how to accomplish some of these tasks. So their objectives were pretty simple: guide the reintroduction of employees into the work environments and create a framework focusing on health and safety of all employees. Now, this document is geared toward employees, admittedly, but a lot of these same things that we're talking about will also apply to health and safety of your customers or people that come into your place of business. So even though it is geared toward employees, there's a lot of information that can certainly apply across the spectrum. So what they did is they broke into 6 different categories that they focused on. One being the physical environments, medical and health concerns. There's been a lot more discussion recently with stress, emotional and mental health issues. I've participated in a number of these webinars, and the last one I was in actually had a poll that says, what's your biggest concern as a business owner? And actually stress and mental health were the top concern in that particular group of people that was on that webinar. So it is something we do need to address because of the fact that people have been away from the workplace. There's stresses associated with working in a place you're not used to working at. There's, you know, things having to do with caring for other family members. There's some higher rates of unemployment. There's a ton of other things that are happening in the world right now. So it's really important as employees or employers, I'm sorry, to recognize that some of these emotional and mental health subjects are going to be important to work with. We're going to touch a little bit on employment, legal, and HR. We've kind of de-emphasized some of these, even though there are some considerations there. And we're going to focus more on effective communication. We're going to talk about a few external factors that obviously we can't control. And then we're going to focus at the end on let's build confidence, and confidence in our workforce, confidence in ourselves, confidence in our customers, that we're safe to move forward and proceed. So where do you get started? You want to start by just gathering information. As I mentioned, this SAFER program is a great starting point. I'm going to show you a slide in just a minute on an OSHA website that's really, really helpful. CDC, the governor's office, Department of Health Services. These are all resources that are very credible that can help you gather information that's going to help more specifically with your business. We also want to start with a clean facility and make sure everybody knows that you have a clean facility. And that's just kind of step one on building confidence, is people need to know that when they come back into your building, you've cleaned it, it's safe, and ready for them to get back to their workforce. We do want to assign a leader or a safety task force or committee. It's always nice to have a variety of opinions and input and perspectives when you're dealing with any safety issue, because people have different responsibilities, and therefore their perspective on that particular task or job is going to be a little bit different than you as the overall leader. So it's important to welcome that input and feedback from all levels of your company, because everybody has some important perspectives to share. You want to look at your particular place of business and try to identify what your exposure potential is, and identify any gaps that may be in place. And we're going to talk briefly about how to do a safety analysis, or and how to go about it. And we want it to be a simple procedure, not something overly complicated. And so we'll kind of go through some of those steps on how to do that. But we really want to, when we determine our exposure potential, OSHA has a really interesting, it's called a risk pyramid. So if you want to Google OSHA risk pyramid, once again, that gets into some details that we don't have time for today, but that once again can help you determine the level of exposure your specific business or business type might have according to some criteria that they've identified. And we want to, when we're analyzing our business, look at the 3 E's. That would be everything, everyone, and everywhere. I would encourage you to look at your business from the perspective of a client walking in your front door. What do they see? What kind of procedures or processes in place? You know, do they see a nice clean environment, or do they see something else, right? So we want to kind of look at it a fresh set of eyes and make sure that we're relating it to what the customer's perceptions are. We do want to develop emergency preparedness and disease prevention plans. These are 2 separate things. Both of them are really, really important. We're more focused on the disease prevention plans, but as I've stated in some of these past presentations, having an emergency action plan is also really, really critical. And those develop, depend on other factors. Maybe you have to evacuate your building, maybe there's a fire, maybe there's weather, there's some other reason you need to take emergency action in your place of business. So having that plan in place is really important. But on the disease prevention side, it's not quite as clear cut, because it's hard to identify everything that every disease might have. But we do need to have an outline in place so that we have processes, procedures, checklists in place that we can follow. And that's really important. As people come back to work, we orient them to those changes and make sure that we're getting a comfort level. I mentioned OSHA has a great site. This particular page, I would encourage you to write that link down. I'll have it at the end as well. So if you can't get it right now, we'll have it on the resources page. But it has a lot of standards, updated information, hazard recognition processes, important medical information, and it also has some very industry-specific guidelines, whether you're a taxi driver or a manufacturing facility or an office building. It does have some different guidelines that are going to help you move forward. This is what their landing page looks like. And certainly on the highlights tab and the control and prevention tab is where they have some really, really important information on industry specific things. Okay, so I would suggest that as another starting point in addition to the SAFER documents. We talk about the hierarchy of controls, and so it's really important when we identify a hazard. We've tried to determine what's the best way to control that hazard. And as you can see on this particular graphic, the most effective hierarchy is to eliminate, physically remove the hazard. So let's say we had a particular task in our operation that caused a hazard. The best, most effective way would just be eliminate that task completely, or substitute it for a different type of task, right? So, but when we're dealing with a virus, we don't have a way currently to eliminate the virus, and as long as people are present, we can't physically remove the hazard. So elimination and substitution aren't going to be real effective when you're dealing with a pandemic. That's where we need to focus on the engineering, administrative, and PPE controls. And so engineering controls are those that are most effective when you can't eliminate or substitute. And these don't depend on people's behavior. These are things that isolate the employees from the hazards. And so they are things such as physical barriers and change of equipment or rearranging workspaces, or those types of things that help create the distancing we're looking for, create some sort of separation between people. just trying to make sure that whatever, you know, in spite of what the people do, these controls are in place to help. The administrative controls are more geared toward people's behaviors, and that involves training. It involves different work hours. It could be a number of different things, signage, like say education, those kind of things. They're going to help train people and give them guidance and have them modify their behaviors in order to help control the hazard. Then the last one, and you see is the least effective, is PPE. And the thing is about PPEs, if it fails, then you have a potential exposure. So it's important to try to go through the other types of controls first that are more effective, but as a last resort, if we can't do it that way, then PPE is. And you know, face masks or face coverings are an example, goggles, any other types of protective equipment are examples of this. Now, it's also something that can be pretty easily done, and for that reason, some businesses try to go directly there rather than try to identify the other controls first. So we should always look at an engineering and administrative first, then PPE last. And the other thing to think about with PPE, especially when you're talking about face masks and respirators, now we have some additional OSHA requirements on training, fit testing, maybe medical exams that are required when you start to go to that level of PPE. So I just want to make you aware of these, because this is how you take care of and try to protect against the various hazards that are there. So the first area that the SAFER document addresses the physical environment. These are buildings, facilities, workspaces, and there's a number of things that you need to be aware of. HVAC, you should plan on changing out the filters, make sure the HVAC system is operating properly. I've seen a lot of recommendations on, if you haven't been in the building for a little while, flush your water system for a period of time, just to make sure that that is clean. Going through additional cleaning and disinfecting procedures. Frequently touched surfaces, you need to create a schedule on how often those should be cleaned and disinfected. Methods of physical distancing, and we're seeing this a lot on the retail side of things. A lot of graphics, a lot of floor markings and spacing and that kind of thing. Some of them are pretty nice looking, others are, you know, duct tape, right? So, but whatever works for you is gonna be the best option. We need to think about communal areas of food and drink. So in some places, self-serve kind of drink dispensers are not available. In an office environment, community water dispensers might be an issue. Community refrigerators where people are gathering and putting their things in. So we need to look at those kind of areas as potential exposure points. Entries and exits, when we talk about no touch, whether it's an automated door, which is a little bit more expensive, but something as simple as, you know, putting a dispenser of hand sanitizer wipes near the door so that people can use that to physically open the door without touching it, and then having a disposal point right on the other side of that. We're seeing that a lot in public restrooms, for example. The paper towel dispenser is right next to the door. You dry your hands, use that towel to open the door, and then dispose of it immediately. So it doesn't have to be complicated. It can be some pretty simple procedures like that. And then limiting gatherings, whether it's in break areas, whether it's meeting rooms, conference rooms, trying to ensure that proper distancing and eliminating larger gatherings until we have a better handle on the virus. So in relation to the physical environments, we need to conduct a risk or hazard analysis. And I touched on it briefly earlier. What we want to do here is break various jobs down to individual tasks and then analyze those tasks to see what are the potential hazards and then what are the potential controls to mitigate exposure to that hazard. And so let's say if you have a hotel and you have a person that's at the front desk, there are some potential hazards. You know, there's the usual safety things, trip and fall, and those kind of things. But when it comes to the pandemic, now we also have to look at other types of hazards having to do with contact with other people. So do we put up some sort of shielding? Do we put markings for proper spacing? Do we automate that system and have that person reassigned to do something else, and people would check in either on their cell phone or remotely or things like that? So those are the kind of things we want to look at. And so you want to break down all these various tasks, analyze, and then identify a proper control. The other thing we want to look at is industrial hygiene type controls. And these are actually in 4 different categories: physical, biological, ergonomics, and chemical. With this particular subject, we're more focused on the biological aspect, but when we're also introducing additional cleaning supplies, then we do have to have some attention paid to the chemical side, because some of these cleaning agents could potentially be harmful if they're not used correctly. So if you, once again, are looking to follow some of the industrial hygiene processes, we want to anticipate the hazard, recognize it, evaluate, control, and then confirm that everything's working. And along these lines, the bloodborne pathogen standards can be really, really helpful. The personal protective equipment standards from OSHA are going to help guide us on what levels of different personal protection that we need to do. And then also the respiratory protection standard. And this is when you start to get into respirators and masks and those kind of things, and the requirements that go along with those. All right, on the medical and health side of things, this is a sample form that the SAFER committee came up with. And one of the things that we have to pay attention to when we're starting to gather information from people is we also have to respect anti-discrimination laws in ADA, in EEOC, and so we are a little bit restricted on what questions we can ask. That being stated, it is acceptable to ask a series of questions, and in this case there's 7 questions. And some of them individually may have some issues with privacy and protection of the employees. But when you ask a group of questions and say yes or no, I can answer affirmatively to all of them without disclosing which of the 7 items they can't agree with, then that becomes a situation where it fits within the guidelines. So what we're trying to do is avoid asking questions that are going to disclose any sort of disabilities. So this is a form that a lot of companies are using, or something very similar to it, for both their employees and sometimes for their visitors. We've resumed some training here at the Safety Council, and we do have a similar form when people are coming into our classes. The very first thing we do is we talk about these sorts of issues, and we ask them to please sign this form that says, you know, as of today, here's the criteria that we're looking at. So that is something that you can use effectively at your business. Other things you may want to consider would be additional screenings. A lot of places are doing temperature checks. Some places are doing direct COVID-19 testing for their employees. And if you have some positive tests, and they're also looking at doing some sort of contact tracing, because what we're finding is when we're dealing with a virus like this, testing is important to identify who has it or who has contracted it and maybe recovered. And along those lines, if somebody is positive, we need to start looking at who have they been in contact with so that they can be properly cared for and accounted for, and make sure the procedures are there so that they're not inadvertently spreading the virus because they may not be symptomatic for a period of time. So I will say once we start getting into these sort of additional screening, We do need to pay attention to ADA, anti-discrimination, and make sure that we're not disclosing information. For example, if the lady scanning the temperature of the gentleman announces it out loud, then we're now disclosing medical information. And if there's other people that are waiting in line to be scanned, that could become an issue. So let's just make sure that if we're doing these sorts of additional screenings, we've researched the guidelines associated with them, and we have the proper safeguards in place to make sure that we're not inadvertently disclosing information. And the thing is, that if we're asking people for additional health information, it might be in, our intentions are perfectly good. Hey, Bob, we want to help you. We want to make sure you're safe. We know you may have some pre-existing conditions, and let's talk about those. Once again, you have to be really, really careful on how you do that, unless you have some specific reason based on symptoms and other things that person may be infected. Asking for some of this additional information could get you into some trouble. As far as additional hygiene and infection control, we want to practice safe behaviors, and those safe behaviors are sneezing or coughing into a tissue or a cloth, maintaining a social distancing, perhaps working remotely. A lot of the things that we've been discussing from the beginning, and these are not new today. These are things that have been the focus all along. So we just want to make sure that we start at the base level and practice those behaviors and instruct our employees how to do so. So if they're not feeling well, they should stay at home. If they have certain health symptoms, they shouldn't come to work. So and then avoiding non-essential contact. Most of us in the business world, I was in sales for 35 years, and every meeting began with a handshake and ended with a handshake. So we have to look at those kind of things. Some of those habits that we have, something as simple as a high five, fist bump, whatever. We just have to try to avoid doing some of those things for the time being, to try to eliminate any non-essential contact. And then you don't realize how often you share things with other people. Something as simple as at the restaurant and, signing the check, right? They give you a pen, and, now several people have handled the pen. So I do recognize that some of the risks here are very, very low, but these are kind of things we do need to think about when we're putting our plans together on how we're going to help protect people. So we do have a slide here that has to do with a protocol of people that either have the infection or have had some level of exposure. And that primary infection protocol would be an individual that has an actual diagnosis, right? So based on that, the individual should be quarantined for 14 days, and they should return to work only after receiving medical clearance from a physician and a documented negative COVID result tests. The areas where they had worked should either be quarantined for 3 days for self-sanitizing or an active cleaning and disinfection of that area. Now, if you have a person that may have been in direct contact with a primary individual or somebody who may have some symptoms, we also want to consider quarantining them for 14 days. And these are people that were within close contact of somebody that is a primary contact within 6 feet for more than 10 minutes. And once again, the same kind of procedure: quarantine, make sure that they've been tested and released by a physician, and either quarantine the space or do an active cleaning. A secondary team member has been in contact with one of the people above, but they're not the primary individual. So there could be a potential exposure, but we haven't confirmed that. So they should not be quarantined unless they begin to exhibit some sort of symptoms. And there's really no secondary action required other than being aware of anything that may develop, some additional cleaning measures in their area would be beneficial, but it's not a requirement. So when we get to this level, it's more of a monitoring type situation. And same thing with the next level, people that have been in contact with the secondary. As you can see, each of these is much less likely to develop the actual disease. So once again, on that level, it's more of a monitoring type situation to make sure that they are safe moving forward. So let's talk a little bit about the emotional and mental health side of things. Because of some of the additional stresses that are in the world now, in addition to the COVID, you may have some people coming into your workplace that they just don't feel right, and maybe it's hard to even put a finger on it. They feel tired, they're mentally, they're just done, they want to take a time out. It makes difficult decision making or hard to stay focused, and it's really easy to become frustrated with other people, and they tend to get in more arguments with family, friends, coworkers, supervisors, because of all these different things kind of swirling around. And they're going to feel tired, sad, numb, lonely, or worried. And some people go into isolation. Some people will exhibit external sorts of reactions to these things. And so especially if people have been out of the workplace for a little while and they're coming back, and then they have the additional stress of the unknown in regards to what's the workplace going to be like, what precautions do we have to take, am I in risk for exposure. All these things create a little bit more anxiety, and it could affect their appetite, it could affect their sleep patterns. Well, we really need to emphasize here that asking for help is a good thing. There's no shame in asking for help, and there's a lot of resources out there. So you as an employer should have your radar up a little bit better or more effectively on how to identify some of these things, and looking at behaviors and things, and just recognize that that person's not quite the same person that they were before, and having some conversation with them. Maybe just that will alleviate a lot of stress and create a little bit more emotional balance, for the lack of a better term. Okay. When we're talking about some of the employment, legal, and HR considerations, as I mentioned, we have ADA regulations, we have OSHA regulations, we have EEOC regulations that all start to come into play when we're discussing some of the information that we're gathering and how we're using that information to proceed in a safe manner. And once again, we can have the best of intentions, but inadvertently cross the line on some of these things. So we want to make sure that your interactions with your employers as a supervisor, as a leader in your company, be positive, be compassionate, supportive, and be transparent. Let people know, hey, here's what we're doing to keep you safe. Here's our procedures. Here's our processes. Here's a new way of doing your job. And we're going to help get you the training to do it effectively, to do it safely. And you have to lead by example. So if your rule in your company is everybody has to have face coverings, if you're walking around without one, that's not a very good example. So whatever procedures or policies you put in place, you have to be the first person to do these things. And so you don't realize how powerful that is until people call you out on it, right? And then, as we mentioned, be aware of some of the regulations that that come into play on these things, so that we're not inadvertently violating some of those. So from the employee side, we want to talk about some of the resources they might have. Because of this, obviously, personal time off is an issue, right? Because vacation time, sick time, we all have some sort of policy in place, but we've recognized, especially during this time, flexibility is going to be a real key, because we may have asked people to work remotely. We may have closed temporarily and people could not come to work. And so we have to decide as business owners, how do we handle that as far as counting toward PTO, or are we just going to absorb it, or are we going to furlough people and they need to have other resources on unemployment? There's a lot of different factors that come into play here. The important thing is we have a really clear communication with what those policies are going to be, because it's that unknown that creates a lot more anxiety. And there are employee assistant programs that are out there. So try to find what additional resources you can tap into as a business owner to assist those employees, whether it's Family Medical Leave Act or short-term disabilities. Research those kind of things to, like I say, most effectively help our most valuable resource, which is our employees and our associates, right? When it comes to communication, it's really, really important to have clear, effective communication. And sometimes if you have a company with multiple leaders and multiple supervisors, you need to kind of decide who's going to be the leader there. But it's also important to make sure everybody that's in a leadership position is, conveying the same message. And it's really, really frustrating for an employee to talk to one supervisor and they tell you this, and talk to a different supervisor and you get conflicting information. It's really important you get together as a management team, as a leadership team, and decide what that message is going to be and keep it consistent from one to the next. And a lot of businesses have to implement some changes, whether it's administrative, whether it's PPE, whether it's engineering. And people may be uncomfortable with those changes because it affects their ability to do their job effectively. So it's really important to not only communicate what those changes are, but why they're taking place, the benefits associated with them, some of the potential hazards. Because if we add PPE, maybe that actually creates another hazard. Right now in construction outside, we're having some pretty extreme temperatures. It's going to be 110 today. So if we specify face coverings, that also affects the body's ability to exchange heat and dissipate heat. So we have to think about those kind of things, and when we're evaluating those, but properly communicate how to adapt to those so that we're not creating additional hazards. As I mentioned before, be supportive, encourage two-way communication, ask for feedback. People are going to feel more valuable and more important if this is a two-way process rather than a top-down, my way or the highway kind of a thing. So solicit that input, because everybody at every level of your operation has valuable input they can provide. And then focus positively on the changes to help reduce that fear and anxiety. Some of the external factors that could potentially come into play is some of the guidelines from federal, CDC, OSHA, state, Department of Health Services, Governor's Office, maybe some local things. Some of these things are in flux, right? They're subject to change as conditions change. So it's important for you as a business owner to stay on top of these kind of things. So, visit that CDC and OSHA website frequently, visit the governor's website frequently, Department of Health Services, see what some of the state guidance and recommendations are, and use those as resources to help you be more effective in your business. And these are things we can't control, right? These are external to us. The other factors is from the community risk standpoint, not all communities are affected equally. We've seen some pretty significant differences, for example, on the Native American communities, on how they were affected versus some of the other ones. We had some rural counties that just last week reported their first fatalities. So some communities have been affected more severely and others not. It really is dependent on the demographics and distancing and some of the services that are offered in these various places are all different. So the risk does vary from one community to the next, and those risk levels can also change. So if that's the case, we also need to plan for a possible change. So that's where we need to think about developing, when we're doing our disease and infection control planning. One element is, a what if kind of thing. What if the risk levels do rise and we have to have some different restrictions or different procedures in place? How are we going to plan for that? And how do we communicate that ahead of time to our employees so that they don't have an unknown type situation? So how do we reduce employee stress? And, I've touched on this: positive communication. Stress is relieved by knowledge and training, right? So train them on some of the various aspects, not only about virus protection, but their particular job. Give them the tools they need to be able to relieve this stress in their mind and concerns that they may be at risk. It's really important to have a good planning process in place, and share that planning with your employees. Get them involved in that planning. Ask for their input. Hey, we have this hazard. We need to try to mitigate it through some sort of controls. What do you think will work? And that, along with, once again, your research from the OSHA, CDC, and all these various reputable agencies, is going to put plans in place, because when there are plans and people see that sort of planning and structure, it creates a comfort level that, you're paying attention, you've recognized the hazard, and you're going to do everything you can to make sure that everybody is protected. And as I mentioned before, you have to lead by example. This is a really, really critical point, that if you're making the rules, you're following the rules. I teach a lot of defensive driving classes, and it would be really hypocritical for me to drive down the road using my cell phone, or to speed or run red lights. And if somebody in my class happened to observe that behavior, I would lose all credibility whatsoever as a trainer. And the same thing kind of applies to the business owners and leaders, is if you're engaging in behaviors that are contrary to your message, it does affect your credibility, and it does create additional stress for the people around you. So the bottom line is, people fear the unknown, and the solution for fearing the unknown is education, training, and knowledge, right? So let's impart as much of that as we possibly can to help reduce that stress. So how do we build trust with customers? One of the things I really recommend is be very visible with your cleaning and safety processes. Let's say you own a restaurant, and one of the things you can do as people get seated at a table, you can tell them, hey, we've already disinfected this surface, but once you're seated, we're going to come through and we're going to give it a real quick additional cleaning and disinfecting just for your safety. And be upfront with that, be visible with that. And when people see those kinds of actions and processes in place, they're going to know that, hey, you're really trying to protect them. Effective signage can really, really help. And not only signage, but markings. Once again, we see a lot of 6-foot distancing type markings. I would encourage you, when you create these types of things, instead of the roll of duct tape from Home Depot, get some signs that look good, that look professional. I've seen places where they've just taken some masking tape or duct tape and put a big X in the middle of a table, right? And I understand the intent, but from a person looking at that, I'm thinking, well, you can do that a little bit better, right? Maybe have a small sign that you put in place, a laminated sign that looks nice, looks professional, that says, hey, we're going to reserve this table to maintain social distancing, rather than a big X with blue masking tape, right? So think about those types of things, because I can tell you that if I go to a place and their tables are taped off with blue masking tape, it doesn't give me a real warm and fuzzy about how it looks like they took a shortcut, right? So these things matter. Perception matters. So do what you can to create a positive message. post some information in the customer contact areas about what you're doing. I was in a drive-through a fast food establishment a couple days ago, and on the outside they had just a really simple sign that says all of our employees are constantly be trained in safe food handling procedures. We've been in contact with the CDC. We implemented these guidelines, and it's just kind of a, even though I'm sitting in my car outside the building, I can see this very quickly and know that this business owner is taking this seriously, and they're doing everything they can to build this trust and build this level of confidence with me. As I mentioned earlier, take a walk in the front door and see what you see. And look at things from the perspective of your customers. An example of this, I was at my cardiologist's office about 2 weeks ago, and one of the rooms they put me in, it's kind of dated and the finishes are a little bit tired looking. There was some holes in the wall where they took some stuff down and never patched it. There's, a leg of a desk that was bent. And I'm looking around thinking, this room just doesn't look very attractive. And it would be really, really simple and very inexpensive to do patch the holes in a fresh coat of paint, right? And it would change my perception a lot, because the facility also reflects on the people that own it, right? So take some of these steps to refresh and make your facility look as attractive and as safe as possible. And there may be times when you need to have some interaction with a customer. Maybe you're observing that they're not properly distancing, or maybe your business does, you do ask all the customers to wear some sort of face coverings and they don't have it. The way you present that to them and the way you interact with that customer needs to be positive and educational, not confrontational, and not, in your face kind of a thing. So it's really important that, because other people are observing this as well, and if they see you treating somebody poorly, they think, well, that could be me next, right? And another way is to communicate your safety and health plans on using social media. So all these different techniques of building trust with the customers are really, really important to make sure that you're successful. So just to kind of summarize, if you have proper planning and research, you've gathered all the important information, you've taken positive actions, it's going to result in reduced stress and increased confidence, not only in your employees, but your customers, and you're more likely to succeed. If you fail to do these things, you're setting yourself up to not succeed very well. So I would encourage you to go to the resources that I mentioned earlier. I'll have a page up right after our Q&A period of some various websites and resources that you can look into. And this is going to be your best road to success. So that said, do we have any questions?
Yeah, this is Robert. We have one question in the Q&A, and it says, if you are taking temperatures and an employee has a temperature, what do you do? How long are they required to stay out of the office?
And that's a great question. First of all, you have to keep in mind the privacy aspect of this. So if somebody exceeds that 100.4, which is kind of the threshold, first of all, if they just came in from outside on a 110-degree day and you're measuring skin temperature, that actually could affect that. So on a basic level, if you give them a little bit more time to adapt to the room temperature and eliminate some of the external factors, and maybe you retest them and everything's good. So it could be a really short-term thing. But as an employer, that's when you need to privately have a conversation with them and ask them to not come into the workplace today until, from a temperature standpoint, I believe they're suggesting 3 days of no temperatures exceeding that limit without the use of temperature control medications like Tylenol and Advil, that kind of thing. So if it's simply a short-term temperature thing, if they're not symptomatic after 3 days for temperatures, then they can safely return. If they have other symptoms that go along with that, that's when you need to think about if you need to quarantine them or do something at a higher level.
Another question, if you do take temperatures, do you log or keep track of them?
Yes, you do want to document as much as you can. Once again, in conjunction with the ADA and the EEOC guidelines, it's okay to document and track them. And actually, it's going to be helpful for you as an employer in case some question comes up down the road. You do have documentation. Yeah, on this day, this employee had this temperature. These are the actions we took, and just make sure you're covering all the legal bases so that if any questions comes up down the road, you have some backup.
Excellent. Thank you, Ed. It doesn't look like we have any more questions in the queue, and we're approaching that hour mark. We appreciate your words. Any last final comments before we wrap up?
All I can say is research, plan, implement controls, and have a positive message. We're trying to reduce stress. We're trying to reduce anxiety. We're trying to build confidence in the whole community, right? Not just your employees, but your clients and customers, your public image. And that's really, really going to be important to your overall success. So do those things and you're going to be rewarded in the end. And I really appreciate you allowing me to spend some time with you today, and look forward to our next presentation.
All right, thank you, Ed. We appreciate your time. We also appreciate all the attendees being on the webinar this morning on the boot camp. Tomorrow, again, we will have the marketing to return stronger. Ed has posted this screen up with these resources. This will be on our webpage with the recording. And so these links will be live on that downloadable download of the slides that you'll be able to do when we get that posted up. Again, we appreciate everybody and have a great day. We'll see you tomorrow. Thank you.